And I know that that is a common concern, is that really there's this thought that wherever I start my first year, I'll never, like, that'll be where I retire. And really, that's not the case for any profession. I mean, that's not how, it used to be. There was a generation where it's like that first job out of college, you stayed there until you retired. And that doesn't happen now. And it's really, I think, especially within our field, I went from adults acute to schools for all K through 12 doing evaluations, then went to just regular elementary, then early intervention, and then spent the majority of my career with NICU babies.
Wow.
If you
so just across the gamut.
I call it birth to earth. I mean, I was like, but if you would have told me, when I was like, no, I need adults and medical, that I would have been doing that, I would have thought you were crazy. But lo and behold, that was my dream job that I never even considered, never even thought about. So I say that because there is so much room for movement. It would be silly to think that 9 months of your professional career would dictate what you do forever. Now, are there things that you can be doing to keep yourself really fresh and relevant in a field that you may want to go into next? Absolutely. So, and this is the thing too, I always like to stress, is that it is hard to get a CF in medical. It's really hard. There's not a ton of people that get to do it. Therefore, medical facilities, hospitals know that it's hard to get a clinical fellowship in those facilities because they often don't take clinical fellows. So that would be really unfair for them to say, no, you just finished your clinical fellowship, but you didn't do it in medical, so we're never going to hire you, knowing that they don't hire clinical fellows. So it's like, I think again, you want to keep your skills fresh. You want any certification that you can do, swallowing or anything that's, the dementia certification, anything that would be valuable to have in a medical setting, keep those skills up. Keep doing things that during that 9 months that you are really going to be to make for an easier transition. Network. I mean, keep in contact and make sure that hey, I'm finishing my clinical fellowship, but this is what I really think I want to do next. What do you think? Will there be options? And again, because there's not enough SLPs to go around, they will not expect you, if you do have some of those relevant skills and did do a rotation in grad school, completed your clinical fellowship and then want to move over, there's many, many places that are willing to say, great, we'll get you up to speed because we know you just finished your clinical fellowship in a school. And frankly, you're still a new grad for the most part. Yeah. So I would say do not spin your wheels trying to find something that may or may not exist and waste that time that you could have already been 2 months into your clinical fellowship. I've talked to people that spent months looking for that dream CF and they couldn't find it. And it's like, man, you could have been already completed some of it. Yeah. And I will say too, you don't know what you don't know. And again, not everyone's me and I'm not everyone, but going into the schools for medical, I realized it just was going to be a better work-life balance for me. I realized I enjoyed that work in a different level. And that we have had many CFs that were bound and determined. And I'm sure, Darian, you can even speak to that were like medical, and then went to schools and fell in love with it and realized that's where they needed to be.